This is a large format thin section histopathology slice measuring 10 by 8 centimeter from the surgical specimen of case 95. Let's analyze the findings by looking at the normal tissue. What is striking is the very red interlobular connective tissue. We can call it extralobular. There is connective tissue mesenchyme inside and in between among the terminal ductal lobular units. This is one TDLU, this is another one, this is a third one. If you squint, you see the huge difference in color between the intralobular and the interlobular connective tissue. The interlobular connective tissue support the basic elements. The intralobular is a functional connective tissue. The luminal cells that used to produce the milk are getting the nutrients through osmosis. So let's go and hunt for pathology, benign or malignant. So far we can see only different size of terminal ductal lobular units. You could count the number of acini. On average, they are about 60. We find other tissue as well. These are fat cells, adipose tissue, surrounding vessels. These are arteries. And then suddenly we arrive at very extended basic elements. Let's call it terminal duct. We are going to see distended acini as well. What is interesting here is that among the cancer cells, some call them punched out holes. On the 4 micron histology section, they look like holes, but in a 3D pathology, these are spherical cavities. The cancer cells produce fluid and they fill the spherical cavity within which some homobody-like calcifications may occur. They result in the pearl-like calcifications on a mammogram. Let's look for more. These are all abnormal neoducts. And this one is full of carcinoma and is surrounded by lymphocytes, these so-called periductal lymphocytic infiltration. Intensive research is going on to find out their real role. Here are ducts and duct-like structures. The cancer cells distend all these cavities. Once again, we arrived at normal TDLUs here, but the cancer is here. And then here I would like to show you 2 very interesting findings. This is one of them. It's a cross-section of a duct. There are very few cancer cells left within the duct because there is necrosis, apoptosis. What is interesting for my eyes is this exodus. There is a breach here on the boundary, and the cancer cells just flow out like lava does. These are the so-called dedifferentiated cancer cells that can cause so much harm. But if we look at this part, here is a huge breach again, through which these cancer cells oozed out. This is neoduct genesis. They don't have associated terminal ductal lobular units. They are contorted. They are distended by grade 2 and often grade 3 cancer cells. Right beside it, there is a longitudinal section of a duct-like structure, certainly not normal. Ducts are normally simple tubes. The lining cells are the so-called clinging or clinging cancer cells, creeping along all the way the inside wall of the basement membrane. They produce fluid. These in the lumen are macrophages. Very nice looking, big, fluffy cells. The good friend of carcinoma. It's a never-ending story as you see here. Now we understand what is going on. In the fluid, which is viscous, getting more and more concentrated, these flat, concentrated proteinaceous material are formed. The protein attracts to itself calcium. So now we understand how the flat stone-like, skipping stone-like calcification is formed. It takes a long time before these flat stone-like collections of proteinaceous material are formed. And as you see, the macrophages are guarding the events all the way to the end.